Hi everyone, I'm Dr. Eric. Today we're going to talk about reasons why you might see blood in your dog's urine. So the medical term for blood urine is hematuria. Hema is blood and urea is urine, so blood urine. We're going to organize these causes into two main categories, one being local problems, meaning just within the bladder, and then systemic problems, which means kind of either body-wide or multiple organs that are involved. Local problems just in the bladder, you might have some sort of causes of irritation or inflammation within the lining of the bladder wall. And when those cells are irritated or very inflamed, you'll see blood in your dog's urine. So causes for that are primary bacterial problems or primary bacterial urinary tract infections or UTIs. That is much more common in female dogs than male dogs. Just like in people, more likely for females to get UTIs than males because of anatomy. The entrance of the urethra, which is the tube that brings urine from the bladder to the outside world, is closer to the anus, which has bacteria. Those bacteria can travel up the tube and into the urine within the bladder and cause urinary tract infections. You can also have secondary urinary tract infections, which can be from an underlying cause from either urinary stones, which I'll talk about in a minute, or systemic problems, which we'll get to later on in the video. So urinary stones, there are many different types. We're not really going to talk about that. That could be a whole nother video. But stones and bacteria, certain types of stones especially, have a relationship with bacteria. That bacteria produce these enzymes that make the bladder more favorable environment for stones to form. And then you have these stones that actually act as a hiding place for the bacteria from antibiotics. So let's say a dog's showing urinary signs, so it's drinking a lot and peeing a lot and straining, and it has foul smelling urine and maybe bloody urine and all that. They get started on antibiotics, maybe the signs go away, and then once the antibiotics finish, the signs come right back because those bacteria have actually been kind of attached and hiding behind the stones, and unless those stones are addressed, the bacteria are just going to come right back after the medications are finished. Another local problem that can cause hematuria or blood urine is bladder cancer. Now, it's not a very common type of cancer, but it's one that we see. The most common type of bladder cancer is called transitional cell carcinoma, or TCC. It's usually a mass that lives within the neck of the bladder, right where the bladder kind of becomes the urethra. So it can, if it gets big enough, obstruct the path of urine, causing the dog to strain, which causes an irritation and inflammation, and then you get your bloody urine. So the main local problems, again to recap, are primary bacterial urinary tract infections, secondary urinary tract infections due to some other underlying cause, which might be urinary stones or cancer or a systemic problem. Now, systemic problems, there are several of those that can cause bloody urine. One is bleeding issues or clotting issues, so that can be toxic. Either the dog ate things like rat poison, garlic or onions, or pennies minted after 1982 or 1983 mostly. Now, you'll usually see, in addition to bloody urine, you'll see signs of blood from other places as well. So you might see bruising throughout the skin, or the ear flaps, or even on the eyes, or really anywhere else. So there's usually some other signs that point to systemic bleeding issues, but sometimes they don't always read the textbook, and you might only see bloody urine. Another cause is immune-mediated diseases. So that's when the body kind of attacks itself, and it can attack either its own red blood cells or its platelets, causing obviously some bleeding issues and that can lead to bloody urine. But again, you might see bruising throughout the skin or the eyes or the ears. There might be other signs like not feeling well, decreased appetite, that sort of thing. One of the other causes of systemic, or another systemic reason for hematuria, it could be trauma. So let's say the dog got hit by a car or was attacked by another dog. Usually, again, you'll see other signs like road rash, broken bones, punctures, that sort of thing that might be leading you into a different direction that of an underlying cause from the bloody urine. You might also have anything that can weaken the immune system, so endocrine-related disease like diabetes or Cushing's disease. Diabetes, especially because with diabetes, or especially diabetes mellitus, being high blood sugar, you'll have a high urine sugar as well, and having all that sugar in the urine is perfect for bacteria to thrive and grow off of, leading to secondary bacterial urinary tract infections. Cushing's, or when you have excessive high steroid levels in the blood, whether that's dogs on very high steroids or the body's making too many steroids on its own, can weaken the immune system, preventing the body's natural defenses against bacterial urinary tract infections, and then again leading to secondary UTIs. You can also have kidney disease, whether that's infection or kidney stones or cancer or degenerative changes that can cause bloody urine. And in male dogs, you might have prostate disease that can potentially cause bloody urine as well. So you can see there's lots of different reasons or different causes for bloody urine. Again, to sort of recap, local versus systemic. Local would be primary urinary tract infections, or secondary due to either stones or weakened immune system. Then you can have cancer, versus systemic problems being either bleeding issues, immune-mediated diseases, diabetes, Cushing's disease, trauma, or kidney disease or prostate disease. So the way you kind of go about deciphering which one to do, you can imagine the treatments for all these diseases are very different. Primary urinary tract infection might just need some antibiotics and some anti-inflammatories, and the dog would be just fine. Versus things like immune-mediated diseases, antibiotics might not be what that dog needs. So kind of having a step-by-step approach in a veterinary office to work the case up would help get the dog the help that it needs. So the veterinarian will usually start with a thorough history, the signs that you've seen at home, how long it's been going on for, any other physical exam findings, and then probably start with a urinalysis, which will tell you a wealth of information. Is there an inflammatory reaction in the bladder, bacteria, any signs of crystals, which might be consistent with stones, and then they might be able to make a decision that way. Can we start treating, or is more information needed? Which might be blood work, looking at the kidneys, looking at the platelets or the red blood cells, or systemic inflammatory reactions, that sort of thing. You might also get recommended imaging, and that could be x-rays, especially if you see crystals on the urinalysis, or ultrasound, and they kind of do go hand in hand. But if you see crystals on the urinalysis, the doctor will likely recommend x-rays just to make sure, are there any stones within the bladder or the urethra or anywhere along the urinary tract, which can be causing the problem. Some stones do not show up on x-rays, some stones do. The most common ones do. But then you can also have an ultrasound, which might pick up other stones, but might not pick up everything. So they do kind of go hand in hand and complement each other. So with the blood work and the urinalysis and the imaging, the doctor will be able to get a more thorough idea of what's going on and be able to recommend the best specific treatment for that specific individual, getting the highest rate of success for treatment. So again, if you're seeing bloody urine in your dog, go see your veterinarian, tell them exactly what you're seeing, how long you've been seeing it for, and then we'll make a treatment plan based on that specific individual and get a specific treatment going for to help that dog. So if you have any questions, call your veterinarian, and we'll see you next time. Thanks. Bye.